Now, heart health remains one of the most important pillars of the overall well-being, especially in today's fast-paced world where lifestyle as well as stress plays a major role in shaping our health. And to shed light on the latest advancement, of course, in the cardiac care and prevention as well as treatment, we are joined today by a distinguished expert in the field. We are pleased to welcome Dr. Alsulaimi, a consultant in the interventional cardiology. Doctor, thank you so much for being here with us today. I hope you're doing fine.
Thank you and good morning, Iman. It's always a pleasure to be here. Thank you for hosting me.
You're most welcome. Now, Dr. Alsulaimi, to begin with this, how would you actually get to describe the current state of the cardiovascular health in Kuwait as well as the region itself?
Yes, great question. Cardiovascular disease is on the rise, definitely over the last decade. We know from registry data we have that it's on the rise, it's increasing, and there's way more patients presenting with cardiovascular problems.
Yeah, absolutely.
And it is a problem, it is a big problem.
Absolutely. So what do you think are the interventional cardiology, which involves the cardiology, absolutely, the viewers, actually I'm missing out on this one. So we often hear about the minimally invasive procedures. How do we actually have these advancements change the way that the heart diseases are treated in today?
Yes, so let me give you a little background about minimally invasive procedures. Catheterization goes back to the 60s. It was devised by a doctor called Charles Dotter.
Yeah.
And he did it on the leg, actually. He did it on the artery on the leg.
Really?
Yeah, he used a catheter just to dislodge some clot in the leg and open up the artery. And then in the 1970s, there was a Swiss doctor called Andreas Grundzig, and he's the first one to actually intervene in the heart arteries.
Okay.
So he used a catheter and a balloon to open up the blockage in the heart artery. And then later on, eventually things became more advanced and we developed scaffolds, which are stents or metal mesh that open up the arteries. So before this all was devised, patients were coming in and they would have heart attacks, and a lot of them were just treated by going into the hospital and dying. So the survival rates were so bad that there was nothing life-saving for them except for doing open heart surgery that was developed in the 1960s. So catheterization for the heart, especially for the heart, is a life-saving procedure.
Yeah.
It's definitely a life-saving procedure. Any patient that comes in who is having a heart attack, we can easily, within minutes, open up the blockage and save the heart muscle, which is quite remarkable. Also, it can be used for diagnostic purposes. So we can diagnose people who have blockages before they develop heart attacks. That's another important aspect of what we're doing.
Yeah, all right. So, Dr. Ali, now we often hear about the minimally invasive procedures. How are these advancements changed the way the heart diseases are actually treated today, from your clinical experience-wise in today's generation?
So we can treat it in many different ways. So as I mentioned, minimally invasive procedures is just basically a needle stick kind of small incision, either from the arm or from the leg, and using that access we can reach the heart. We're using catheters, and then with these catheters we can easily advance wires and all kinds of equipment, whether it's balloons, stents, other equipment to open up blockages. So that by that we can easily manage or treat blockages and save patients' lives.
Humanity, of course.
Yes,
How long does it actually get to take for a procedure to happen?
Yeah, normally a diagnostic procedure, just to see the arteries, whether they have blockages or not, it takes a few minutes, 5–10 minutes maximum. It doesn't take very long. It's actually very simple. The patient remains actually awake throughout the procedure. He doesn't need to be on a sedation, or he doesn't need to be asleep. He's just awake. We just give some local anesthetic, and then we can just do the procedure very easily. It's a day case, actually. Patient can go home the same day.
Yeah.
And if we're talking like opening up the artery and treating the artery, it can range. It can take from few minutes to several hours. If we're talking about very complex blockages, it can take a long time to open them up. It depends on the case.
Yeah.
But generally speaking, it's a very short, simple, straightforward procedure.
Depending on the patient's problem, of course. Now, doctor, from your clinical experience, what are the most common risk factors leading to the heart disease among younger patients nowadays, especially in today's fast-paced lifestyle? We have seen a lot of major changes in the way that people actually get to eat, the stress levels and everything among that. So how does that work?
Yes, great question. First of all, there's a genetic factor. A big genetic factor that plays a role. We've seen patients, for example, who smoke and have an unhealthy lifestyle and they don't develop heart disease, and patients who have more of a healthy lifestyle that develop heart disease. But having said that, there's, I mean, obviously things like diabetes, high blood pressure, cholesterol, bad habits, smoking, all of these play a big role in developing cardiovascular disease.
Okay.
And now, you know, one of the reasons why it's on the rise is probably because of unhealthy habits.
Yeah.
You know, now we can easily get food in our doorstep. Before it was more of a hassle to get food.
Absolutely.
But these days it's just that quick. You know, if you go back to the 1950s and 60s, people were like hunting for food probably, or searching for food.
Yeah,
it wasn't that easy to get it.
Yeah, and even far so more than that, as you explained, the 1950s or anything beyond like what we have experienced, the food was quite different back then. It was more healthier.
Exactly.
It was more natural. There were organic stuff back then, but nowadays it's all processed food, which is actually the main cause of how patients are actually evolving or to have these kind of diabetes or other kind of heart diseases.
Exactly.
Yeah.
You said it perfectly.
Absolutely. Now, Doctor, there's a growing concern about the silent heart conditions. So what are the early warning signs that people should never get to ignore?
So when it comes to silent conditions, it's a very general term, but we have patients who have silent heart attacks. And there's very little you can, you know, there's little warning for the patient if that happens. One of the things that you have to be aware of as a patient or as a, and just generally speaking, is to do early evaluation.
Okay.
So you have to evaluate yourself early. Don't underestimate things. Like, don't say, oh, I'm fine, everything is okay. Go and do some tests, just some simple tests, whether it's blood tests or x-rays and things like this. There's a very nice test that I like to do. It's called cardiac calcium score, or CT calcium score.
CT calcium.
So you can just do a quick scan of your heart and you can see if there's any plaque buildup just by doing a scan that takes 2-3 minutes. Easily done in any center here in Kuwait. It's very abundant. You can easily do it. The computer actually analyzes the scan and gives you a score.
Oh.
So if you have calcium buildup, then you know you have some plaque and you can easily manage it. You know, whether you change your diet, exercise, take some medications, things like that. But silent disease by itself is very hard to determine. But my suggestion, any patient that's having anything weird going on, strange, they're not sure what's happening, just go and get tested. There's no harm in getting tested.
Well, doctor, now that you're speaking of it, I had a lot of people who have this scarcity when it comes down to the heart issues. They always think that, you know, whether they have a problem right over here, they think it's probably concerned to it, and most of the time a lot of people do that. Or either on their arms, which is, I think it's more closer to having a heart problem rather than the area over here. Which one do you think is?
So the presentations can vary and can easily be missed. I had a patient a few weeks ago. He was saying I was having throat pain.
Oh,
yeah,
that's
just
new.
by moving a little bit, he was having throat pain. And some of the doctors who are not heart specialists, they were just thinking, okay, throat pain is not related to the heart. Then
he must have an
must be
inflammation.
having something else.
Yeah.
But it turns out it's heart. It's the heart. He had a heart attack. He was having a beginning of a heart attack because of this throat pain.
Okay.
Some of them even have jaw pain or headache or something like this.
Okay.
It can vary. It's very strange because the heart, the nerves that supply the heart, they can easily go to other areas in the body, whether it's the arm or the neck or the back.
Yeah.
It varies, but there's the way, because we're very experienced as physicians, we can easily differentiate between whether this is heart-related or not heart-related.
Or something else.
So again, like whenever you're feeling something strange, you just go to get tested, go see a doctor. You know, that way you're kind of reassured that nothing is going on.
Yeah. So what do you think is the most common age where people usually tend to come for a checkup or either have a heart disease problem? Is there a certain age?
It depends. I mean, it's very hard to say a certain age group. I mean, it varies. In my clinic, I see patients from the 20s, 30s,
Now
40s.
that's the new generation's problem.
Yeah.
I think
The elderly are the less likely people to come, actually.
like I think
Actually their sons or daughters are the ones who push them to go and get checked. It's strange. Yeah, the younger people, they go.
Yeah.
But the older people tend to like just listen to their, you know, either granddaughters or daughters or whatever.
Yeah, it does
and
make
they
sense.
end up going.
It does make sense. So with the rise of stress, like I was talking about earlier, the unhealthy diets and the sedentary habits, what practical steps can actual individuals take to protect their hearts or their heart's health on a daily basis, now that we're speaking of this new generation, that they have tendency to have the heart issues more so likely than the elders nowadays?
Yeah, so stress, as you mentioned, it can lead to bad habits.
Yeah.
Smoking, no exercise, eating unhealthy food. So obviously what is important is they try to engage in healthy activities. So exercise is very important, daily exercise. Even moderate exercise, cardio exercise is very, very useful.
How do you actually get to do that?
You can use a treadmill, a bike.
Okay.
If you want to go out
Just
and
walking.
walk, even brisk walking helps a lot with heart health.
Does hiking work?
Yes, of course, yeah. Because if you're going on a hill, it's
Yeah.
actually good for the heart. It's really like makes the heart work, and that way it helps. You know, food, of course, eating healthy.
Yeah, one of the main.
I like to say Mediterranean diet. I like the Mediterranean diet, so I always urge my patients to have Mediterranean diet, which is basically food high in vegetables, fish, and olive oil. Olive oil is a good substitute to like animal fat.
Okay.
Like butter, and those are not good.
Can we do like coconut milk instead if we don't want to do oil?
Coconut milk is actually high in fat.
Sorry, coconut. Yeah.
Yeah, coconut is high in fat. It's not really that healthy.
Really?
Yeah. If you want good fats are in olives, olive oil.
Okay.
That's my suggestion. So I always say Mediterranean diet.
All
I
right.
like to use that because the food is always healthy, it's tasty, and I think a lot of people will enjoy it, you know.
Well, thank you so much, Dr. AziadiQ8, for being here with us. Our guest, of course, the specialist, of course, and the interventional cardiologist. Thank you so much for being here with us today in the studio.
My pleasure.
Thank you, and we will be right back right after this break. Stay tuned.